This is an audiovisual representation of a study published in the Journal of Bone and Joint Surgery in 2025. Perioperative inflammation is associated with an increase in postoperative complications following total joint arthroplasty, or TJA. However, many conventional preoperative inflammatory biomarkers are not predictive of clinical outcomes following TJA. Recently, inflammatory biomarkers like complete blood cell count or CBC-based ratios, that is, CBRs, including the neutrophil-lymphocyte ratio or NLR and the monocyte-lymphocyte ratio or MLR, have been shown to have prognostic value in perioperative settings. Studies also suggest that dexamethasone, which is known to exert anti-inflammatory effects, may reduce the risk of postoperative complications in patients undergoing TJA. Whether its effect is more pronounced in patients with heightened inflammatory responses is, however, unclear. Now, in a new study, researchers have investigated the link between preoperative CBR values, dexamethasone exposure, and postoperative complications in patients undergoing total hip arthroplasty, or THA, and total knee arthroplasty, or TKA. For this, they retrospectively identified 32,849 adult patients who underwent THA or TKA from the U.S. Premier Healthcare Database. Further, they assessed the 90-day postoperative complication rate and a protracted length of stay, or LOS, of 3 or more days between dexamethasone-exposed and unexposed patients using multivariable logistic regression models. The researchers also evaluated the marginal effect of dexamethasone exposure on these outcomes across CBR values. Among the patients included in the study, 38.93% underwent THA and 61.07% underwent TKA, while 67.83% of all patients received perioperative dexamethasone. The findings revealed that dexamethasone-treated patients experienced fewer complications when compared with untreated patients, and were less likely to have an LOS of 3 days or more. Notably, patients with a preoperative NLR value of 1 or more and an MLR value of 0.36 or more who received dexamethasone were less likely to experience postoperative complications. Furthermore, dexamethasone use was associated with lower odds of an LOS of 3 or more days in patients with the highest NLR and MLR quartiles. Overall, CBR values can help identify patients with an inflammatory phenotype who are more likely to benefit from dexamethasone treatment following TJA.